Okay, so here we are, the Board of Health meeting on April 21st, and we're meeting by Zoom, and the meeting is being recorded for the use of people who can't be here. And there's somebody else here, a person who's not on the board.
There she is. She's unmuted now.
Hi, I'm Mary David. I'm just
Hi, Mary.
sitting in for the meeting. I'm on the Conservation Committee.
Oh, cool. Excellent.
Welcome, Mary.
Thank you.
So while we're waiting for, at 7:15, we're expecting the Shutesbury Athletic Club people. And I didn't think to send it earlier when I got it, but I sent it around just now the letter that Mark sent detailing their plans for opening, so we can consult that. I sent it to you just now by email, or a few minutes ago by email.
I think I got that earlier in the day.
You did, right? I sent it to you, but I didn't send it to everybody else.
Oh, I see.
Sorry.
That's okay.
Kat, this is Maureen. I had a chance to read it, and just so you know, both Alan and Mark are, they're available to us.
Yeah, I'm actually on right now. I know I'm early, but I just wanted to make sure I got connected.
Hi, Mark.
Hi.
Can we approve the minutes from last meeting?
Yes. So moved.
Everybody cool with that? Any changes recommended? Hearing none, I'll consider them approved. Grace Banish is going to Zoom in around 8 o'clock to talk about annual town meeting. I sent her an email asking her what role she envisaged for the Board of Health at annual town meeting. And because I said probably less than last year, but not nothing. And she said, well, I wasn't paying attention to you guys because I was running the whole meeting part of it, the election part of it. So she wants to hear what we have to say before we come to any conclusions. Since we are killing time here, do we want to talk about the PFAS testing business? Arlene, I think that you have some things to say about that.
Not directly. I will say that we have applied and been accepted and have received the sampling bottles and have yet to do our sampling and send it in. But I only asked that something more be put on the agenda because of some communications that we've had to the Board of Health email from a town resident who is uncomfortable with what he thinks is some withholding of information on the part of the board. And that same individual has called me at home and
I'm sorry.
Yeah, and is offering on the one hand, wanting to try to play a positive role in this campaign to have PFAS testing done in town. But anyway, I have been less involved with the details of PFAS testing, so I don't feel qualified to speak to him. I've been more, as you know, involved with the COVID related and vaccination related stuff. But do we want to encourage him toward any particular role, or that was my whole reason for the agenda, not about PFAS testing itself.
Right, I realize that. Well, I did suggest that the role he could play would be to encourage people to sign up for the testing. And you saw the response I got.
I did.
It was not helpful.
Yeah.
And as far as his sense that information is being withheld, I think that the new message that we've crafted is going to address that.
He had, in the voicemail left for me, there was reference to identification of Shutesbury as I forget the phrase he used, but as a hotspot or a trouble spot. And so I did not attend that meeting for local boards of health with DEP, so I can't answer to that. But
Well, I don't think that our town was identified as a particular trouble spot. They didn't give that impression at all to me. Al,
yeah,
did you have that impression?
No, not at all. They did
Yeah.
have a couple of areas that they were sort of concerned about, like behind the fire station,
right,
Mhm.
natural place where they want to
yeah.
to test.
So he may be overstating that aspect of things a little bit, but so you'll see, I responded to him from the Board of Health email, and he responded back to me in much the same tone that he did to you, Kat. And
Mhm.
I'll get back to him one more time and just reiterate that maybe if he wants to do what he wants to do as a private citizen to promote the testing, the participation in the program or application to participate in the program, that would be best. But do I want to say anything, or do we want to say anything to him about we are not identified as a particular hotspot?
Maybe that's something that we should be more explicit about in the message. I've tried to say that this is part of a sort of fact-finding mission where they're
Yep.
studying everything in the Commonwealth, but maybe I need to emphasize that a little bit more.
Yeah, that they're
And-
right, fact
and-
finding to find out where the hotspots are. Or where the
Exactly.
trouble spots are.
Exactly. And I
Yeah.
mean, the idea, I mean, he was saying, he wanted to help. And in his phone message, he was actually saying that he left at the Board of Health, that he wanted to help the many Shutesbury homeowners who are drinking contaminated water.
Mm,
So, I mean, he's just getting way, way ahead of himself.
sure, before there are any facts on the ground. Yeah,
Exactly.
right.
Exactly. And go ahead.
Did the original message that we sent out point folks to the DEP website for this?
Yes.
Yeah,
Yes.
I thought it did. And, you know, I think that their messaging is pretty clear that this is the intent of the project, is to.
Yeah. Okay.
Yeah. Yeah. I thought so too.
And that we're
but,
not withholding any information because we don't have any information.
Exactly.
withhold.
Because this
Yeah.
is about getting the information in the
And
first place.
Maybe he's zeroing in on those 3 sites in town that were identified as possible trouble spaces, but
Michael also called, he also called Becky. And,
Yes, I know.
And said the Board of Health is withholding information. And
Right.
sorry, I just lost the thread of what I was saying.
It's okay. Happens all the time to me.
Oh, gee, it's getting
Welcome
worse
to
and
my life.
worse. Yeah, right.
Okay.
Oh, and he said that there was a map, that Paul Lyons had a map. And I guess Michael wants the map, but we were asked not to disseminate that map, as I recall. And I don't think it's helpful because most of the dots on that map are just showing geographic distribution of where they would like to
Oh,
sample.
okay.
Just because it's like,
I had shared that map with Paul Lyons.
well,
So
apparently
I'm
Paul told
probably
Michael.
I
Yeah.
did not know that it was not supposed to be shared.
I don't
further, so-
remember why they didn't want to share it, except that I think they thought something just like this, where people would get the wrong idea about
Sure.
what those dots on the map meant.
Sure.
They just meant like, this will be a good spot because it's spread out, like raisins in a pudding.
Yeah.
Yeah, I think it was meant to be a planning document as opposed to a definitive sort of thing.
Right.
Okay.
So let me beef up the message a little bit
Okay.
to make it clear that that Shutesbury is not being singled out, that there are something like 84 towns that are part of this program, and that this is, Al, give me a scientific word for this, like a wide sweep to get broad-based data.
Yeah,
What's-
kind of a regional assessment. Yeah.
Regional assessment, that's
There
good.
you go. Not just in Shutesbury, but in 80-something other towns that are primarily served by private drinking water wells.
Exactly.
Yeah.
Yeah.
Okay,
And then adding in the link back to DEP again.
yep,
Right, okay, yeah, I'll add in the link, and also I put in the message that they can go to our website and read the FAQs. And there are all kinds of links in those FAQs.
okay.
Right.
Okay,
And remember,
I'll-
we
yeah.
we took this approach because it's not our study.
right,
And there are sort of issues of cajoling or manipulating residents to do something that might not be in their short-term or perhaps long-term best interest. So,
right,
so we endorse it, we promoted it, and then we leave it up to the residents to figure out if they want to be involved.
yeah, basically we just gave information about it. Do we need to, do you feel that we need to say this explicitly?
I don't think so. I think
Okay.
it's my personal feeling is that it speaks for itself. It's a state UMass project that that the board thinks is a good idea, and you know, that's
Right.
it.
And in fact, I don't think we've even said that we think it's a good idea. We just said it's out there, it's an option for you. This is what it's for. So there it is. So who's here for the athletic club? Mark's here. Another
Yeah.
Mark is here. David's here. Alan's here. Tom's here. Okay, we've got a huge.
Mark's the one you want to talk to.
Okay,
We have a
well,
huge following.
go ahead, talk to us.
Well, thanks for taking the time. So I know we don't have that much time, but basically what I sent out was a bulleted item as far as what we want to do as far as moving forward, starting with our first dinner. And the first thing I put in that item was about the serving of alcohol. I did talk to them today, the ABCC, and he stated that we do not need to be a restaurant to serve alcohol as long as we serve food. And he did say that that is done on a local level. He said the state does not get involved until somebody complains. And he said, other than that, he said it's at the local level. So I guess I'm asking you, the Board of Health, because he said that's who should be telling us, yes, we can serve or we cannot serve.
I thought that you had to get some way licensed by the select board. Am I wrong about this? Claudia, can you weigh in?
As far as the liquor license goes, I believe that that's the select board that needs to issue that, not the Board of Health.
No, we have that.
Oh, you have
Okay.
that already.
We
Okay.
have the liquor license. We're all set to serve and everything. The only thing we need is the okay from the Board of Health to do so.
Okay.
And also to follow the current, COVID-19 mandates, of course. But we'd like to start serving alcohol with our meals. And he said, and I brought up the thing as I did last time is, I go to a couple of bars and they have a hot dog steamer on their counter. He said it's the local area that dictates how it's done. And he says that's really all you need to serve alcohol. You need a food, and that's it.
Right, but Charlie also said at that meeting 2 weeks ago that the ones with the serving the hot dogs like that were not in compliance.
Well, okay, but I did bring this up specifically. I did mention that. He didn't say they were not out of compliance. What he told me was that the only reason the state gets involved at that level is if somebody complains of what's happening. Then they'll go investigate. But as you know, we're not going to be serving hot dogs on our bar counters. As in the bulleted item, I suggested, when we're open for business, we could serve a simple thing as soup or sandwiches or pasta on a nightly basis. And every night we could have food there available, whether it's something small, but it wouldn't be just popcorn and chips.
Okay. It would be
Okay.
something like a meal.
Yeah, it's something as a meal, appetizers kind of thing, but it wouldn't be just what we have in the back shelf with peanuts and popcorn and chips, things like that. And as you know, I mean, there are times, even before this, we did have soups, pastas, somebody would make a dinner, and so we could do that. If that's the requirement, we could definitely see that that's taken care of.
Okay, and
This is Noreen. I have a question for Claudia.
sure.
Claudia, in the other towns that you monitor that have, let's say, establishments that are primary bar-related establishments, do they require everyone who comes in to purchase a meal or a soup or whatever is available, while they get their drink? Is that a requirement?
That does seem to be a requirement. To be quite honest, most of the towns that I cover don't have anything like the Shutesbury AC Club. They are primarily restaurants. They're not necessarily bars, and the bar seating had been closed for them for quite some time. My understanding of reading the last regulations that came out, which were back in March, is that food is basically considered anything other than bagged chips or popcorn or something like that. So by all means, you could, serve soup, you could serve, pasta, you could serve some sort of a meal with the alcohol. I reviewed what you submitted, and I think that it was very well thought out. I think that you made your points very, very well. I don't see any problems with it. So I'm good with what you've submitted. And I would say that, as long as you're following the state guidance relative to building capacity and maintaining social distance and the wearing of masks, et cetera, and so on, then you should be fine. But I would like to hear from the rest of the board as to what their thoughts are on that. I mean, those are simply my.
Hey, can I make one interject for 1 second?
Sure.
I will agree with you that the bars that I've been into that have to serve food, they do charge. They have to charge you because they have to sell a meal in order to sell the alcohol.
Right.
So they said, even like when I bought a hot dog, it was $2 for that hot dog. Whether I wanted it or not, they had to charge me the $2 for the hot dog.
Right.
Well, that's the source of my question, Mark. So your intent is to
Absolutely. Yes.
ensure that everyone takes in a meal.
Even if it's just the minimal, just so we can say we serve them food. Kind of thing. Yes.
Okay.
So if you're getting an alcoholic drink, you have to buy something. You have to buy food.
Okay. Great. Then the other question I had, knowing the AC as a Friday night dinner person myself, is you addressed in your letter the issue about the bathroom, and I know it's tight as the line goes through to pick up your meal. Can you explain more how you plan to handle those? I mean, those can be some tight crossings in there when people are standing in line.
Right. Well, what I was thinking was, we would have a gap in the line, say from where the narrow hallway starts, say 5 feet prior to that. So somebody coming in the front door would have a clean sweep to the restrooms coming in from the outside. And then basically at the serving line at the counter, we would probably only have 1 or 2 people at a time. Everybody else would be outside waiting to go in.
Okay.
So there wouldn't be any congestion in that small area right
now. Yeah.
But honestly, even if 2 people happen to cross, it is such a brief crossing. And if they are wearing masks because they're indoors right then that would not be an occasion for disease transmission.
Okay.
Anyway.
Great.
If they were both in, if there were two people in a restroom at the same time and they stayed there for 15 minutes, then we've got a close contact, but
Right.
otherwise not.
Okay. All right. Great. Thank you.
On the restroom point, you might just post that it's one person in the restroom at a time. I haven't been in the SAC to note if it's multiple stalls or not, but also in the document that you submitted, there were a couple of bullets that were questions, and I just wanted to see if you were looking for further guidance on that, or
Actually, yeah, thanks for bringing that up. There was one bullet in there that mentioned that was bold, and I met them both for the questions was about patrons bringing in their own alcohol, and that was, I should have removed that. That was prior to me getting a hold of the ABCC, so that you can just read that one. The other one was when we're serving the meals for people that want to sit down, can we use our own dishware? Since we washed everything right there, can we do like we did before, use our own dishware to save on waste and plasticware?
I would support, whoops, I would support that. I think we've learned over time that COVID is not, their objects are not really serving as vectors. It's, you know, droplets, airborne droplets, and something like the serveware, if it's whoever's cleaning up is ideally wearing gloves as they stack dishes and stuff like that, but should be fine,
Okay.
in my opinion. What does everyone else think?
Seems good to me.
Yeah, it sounds good.
Yeah, I would agree with that.
Okay. And as far as serving the alcohol, do you say, I did stand that we would have a server. One thing that came to my mind after sending this out was, what if we were to put a thing of plexiglass for the patron, so that barrier between the bartender and the patron to order, and obviously there's no seating at the bar, so that would be open. And then, so patrons could come up to the bar, get their drink, and go back to their table.
You could certainly do that, put up a plexiglass barrier. But ideally, again, you know, if this is inside, everyone is wearing masks anyway.
Right, okay. So are you okay with
Yes,
patrons
Phil.
coming up to the bar one at a time, getting their drink and going back? As long as they're wearing a mask?
Yeah, I would be fine with that.
Okay, great.
But if you can do the plexiglass thing, that is one more barrier and extra insurance at close quarters. So
Okay,
I would support the plexiglass if you can do it.
okay.
At one point, it was being said that basically alcohol had to be served by table service, that people weren't meant to go to the bar. Is that changed, Claudia?
I haven't seen that. I haven't seen that it's changed. But I think that where we are in phase 4, stage 1 of the reopening, I mean, that really hasn't been addressed anywhere that I've been able to see. But I don't think that there would be an issue for people going up to the bar one at a time simply to retrieve a drink and bring it to their table.
Okay.
And Mark, are drinks being served in glassware, SAC glassware, or is that disposable cups that we're
Well,
talking about?
Typically, we would use glassware, but whatever you suggest, we can do that. I mean, I looked at it for washing dishes, we can wash
Yeah,
glassware.
exactly.
We have the sanitizer right there.
I don't think it's any different than forks and
Right.
spoons, so yeah,
Right.
in that regard.
I agree.
Mark, what are your plans for renting the function room?
As far as prepping and everything like that, you mean?
Well, I mean, are you going to be open for rentals? And
Yes, we actually have had a couple requests already, but they don't want to do the rental until the bar is fully open, and to use it like that. So yes, as soon as we get the okay, I know we have at least one, actually it was a funeral reception in May. And then we have some outdoor events plan. Mark Lester has planned some bands for outdoor events, tentative. Yeah, so what we would end up doing is just going in the night before and sanitizing and the same things. You know, the person who's renting it is still responsible for cleaning up, but obviously after the fact, we would go in after that and clean up, do a thorough cleaning.
Mhm. Well, should we vote if we don't have more questions? Should we vote to accept these proposals by the Shutesbury Athletic Club? Is that how we should do it?
I do have another question, Mark. If there are events, is the rentor going to be the person responsible to try and monitor or encourage people to wear their masks if they're inside for long periods of time, or how is social distancing going to be?
Well, I think we'll obviously have a bartender on duty, and I think what we're going to end up doing is probably have a board member try to be there during an event to see how it goes and to just make sure all the protocols being followed. So for the time being, I think I think we can have an extra person there just to make sure everything is going okay and all the proper protocols being followed.
Okay, that's what I was thinking about, because that bartender can get busy at times out there and maybe not be available to go back to that other room and just, keep an eye on what's going on back there.
I'm not sure it's appropriate to ask the bartender to police the attendees.
No, I agree with you, but I mean, he could keep an eye on the surroundings right at the bar area, but having another board member there during the function, if it's an outside function, we could just be walking around and make sure everything's going okay.
Now, here's a question probably for Claudia. This is kind of a little bit off the track here. Now we're being told that small groups of unvaccinated adults can gather indoors unmasked. Suppose one such group of vaccinated adults wanted to have some kind of function at the Shutesbury Athletic Club. Could they go unmasked in that back room as long as the bartender was not in the room with them?
Pat, may I say the guidelines do say one household at a time. You may gather with one other household at a time.
No, the guidelines say you may gather with unvaccinated people in one other household at a time.
I think the large gathering regulations still apply, though.
Right, large gatherings. Well, we're talking about small gatherings.
Is that cutoff?
I like to think of a small gathering as 10 or 12.
What does the state like to think of a large?
Nobody tells.
Yeah, and
that's one of the big secrets.
Yeah, that's really a large part of the problem, is that I really couldn't speak to that because I haven't seen anything very specific in guidance come out from the state as far as that's concerned.
Mhm.
Last I knew is that it was household members gathering, not necessarily a group of unrelated people that have been vaccinated. And the question is, I mean, how are you going to find out, how do you know whether these people have been vaccinated or not vaccinated? You certainly can't ask them. That's a violation of their HIPAA. And they can always say that they have been vaccinated, and there's no reason, and no one can ask them to present any sort of a card saying that they have been vaccinated. We just have to go by their word on that. I think that's one of those tricky judgment calls.
Right, but I'm imagining a thing where, say, I want to have a party with 11 of my closest friends, and we're all vaccinated. And I want to know if I can have that party unmasked at the Shutesbury Athletic Club in the back room without only wearing masks if we go into the bar area.
Again, that's not a question that I have a solid answer for.
Okay.
According
Okay,
to-
well, that was kind of a digression, but back to the athletic club. Are we Are we satisfied? Do we have any other requests or questions or recommendations?
May I just say that the current governor's order says that gatherings at private residences are 10 people indoors, 25 outdoors maximum. That
Okay, so that's a
gatherings-
small.
Gatherings at event venues and public settings. So venues such as a place that you can rent or reserve, those are limited to 100 people indoors,
Yikes.
150 outdoors, but you also have to stay within the percent of the total building capacity that is stated elsewhere, and
Yeah.
I'm not on that page right now. But whatever the building capacity is, there's some percentage of that, I think it's 50%, that is the maximum, and you have to go with the smaller of those numbers.
Right. Okay. Okay, meanwhile, yeah, right, how, what kind of occupancy limits are we talking about here for the club? For a meal?
Well, typically on a Friday meal, you might get 35 to 50 people. You know, and that's a good Friday meal.
Yeah.
That back room, I believe, is Alan, correct me if I'm wrong here, holds 120 or 100?
100.
100. Okay. So at 50%, we'd be at 50 for Friday meal, but that doesn't include the bar area, or it doesn't include the outside.
Would you be having tables in the bar area? I didn't.
Well, we
pay
do have
attention to
tables,
that.
but I mean, they would be spaced accordingly. So
Mhm.
we might be able to get 3 tables in there, you know, and then, but we have the outside pavilion. I mean, the weather's going to be getting nice, so that's a good thing.
Right.
So you know, what we're thinking about also is getting some more picnic tables, put them out now along the grassy area behind the buildings, also that kind of thing. So I still think we can do our normal capacities for dinners. It's just going to be, people are going to be spaced out more. Outside in the pavilion, right in front of the patio, there's a few tables. We can probably get 2 tables there. There used to be 3 or 4. So, you know, I still think even at 50%.
Well, I just threw 50% out there as I'm not telling you that's what it, have you been told what the percent of your building occupancy is okay in reopening?
No, as far as the percentage of what the total is, no.
Yeah, I'm trying to find it right now and I'm not
Claudia, do
finding
you
it.
know that?
Yes, I believe it's at 50%.
Okay.
That's what I had thought, but
So basically it would be controlled by the number of seats you
Correct.
make available.
Correct.
Okay.
Yeah, and we would announce that in, you know, in the our flyer or our next door Shutesbury, you know, that when we have dinners, you know, it is limited seating because of COVID, and there might be a wait because of that. So
Okay.
I just have one other question mark, because I know people are accustomed to coming into that back room and moving seats around so that they can sit with the people they want to sit with. So again, I just, you know, and I know you're probably aware of all those things too. So it might be something you want to think about in terms of how you try and organize where people do sit, so it provides a safe environment.
right, we will probably end up just taking some tables out and stacking them in the corner so people can't do that, and just leave it at that. I'm sure there's going to be a little tweaking here or there as we go. Find out what works, what doesn't, and what people are trying to get away with and what they're not.
Yeah.
I think we're just gonna, a lot of that stuff, I think we're just gonna have to deal with it as it comes around.
Especially in the beginning, we'll have multiple board members helping out.
Okay, I don't have any more questions. Does anyone else have any more questions?
I guess I would, I guess not to be thinking of things that can go wrong, but let's say we do this and then all of a sudden Arlene tells us that oh, we got a bump up, and the thing they have in common is they were at the SAC for
Or, or I get a case that says, 2 days before I started feeling sick, I was at a dinner at the AC.
right.
And then in a case like that, I'm relying on that person to tell me the names of everybody they spent 15 or more minutes with at a distance of less than 6 feet, masks or no masks. And, you know, they may not recall. And so especially for an occasion where a group has rented the facility or reserved it, does there need to be a guest list?
Yep, and I agree with you. I didn't think about that, but yes, we have talked about that at the other board meetings, as doing a guest list from everybody who enters the building.
Yeah, so even on an SAC sponsored night, you would look for a name of everybody who enters the building.
Correct.
And like, is there an in time and an out time? Like, you know,
Well,
or
we can do that. I mean, we can, you know, we can make that stipulation, you know, for the time
Yeah.
being, this is what, these are
Right.
requirements if you
And-
want to enter.
and mark a way to reach them if we needed to.
Sure.
Because if I'm doing contact tracing, I've got to have either a phone number or an email address, and ideally what town they live in.
Okay.
So that I can find them, or someone from their own local Board of Health can find them and tell them they may have been exposed.
I agree.
Okay.
Arlene, practically speaking, it would seem like the people that would meet the close contact criteria would be the people who sat at a table with them.
Sure, exactly.
So that perhaps there could be individual table signups. So people would come and sit down at the table, and they would put down their
Yeah.
name and contact information. Then they could collect them, and then that would narrow it down quite a bit, and also pin it down so that you wouldn't be calling everybody in town.
Well, I don't pretend to know the best logistical way to do this, but I am trying to think about what would we need if we find out someone turned positive a day or two after they were at the AC? You know, what would, and can we figure it was just the people at that table? Can I rely on that person's recall?
Well, that's why if we
If-
had a
if
sign up for
every-
the
if-
table.
And if everyone is in fact keeping 6-foot distance from everyone else but their table mates, then yes. If people are really doing that. But I know
Right.
socializing happens, you know, conversations
Right.
out by even under the pavilion.
Mhm.
It's trickier.
So the point I was trying to make was that if we do get a positive case, then I'm guessing that everyone puts the meals at the SAC on hold until things get sorted out and that sort of thing. Is that right?
Whatever you guys need to do.
Pardon?
Yeah. Go ahead.
I was just saying, whatever the Board of Health needs us to do, we'll do. That's all.
Yeah, it's sort of a rhetorical question that I'm putting before the Board of Health and also for the SAC board to think about is what happens if we run into trouble?
Well, what is the thinking about why they would have to shut down the plan from that point forward?
Just because it was not a safe operation the first time, and maybe we are trying to do it too early. I don't know.
That seems like a really big assumption, though, that contagion happened at the club. I mean, if we get a cluster, yeah.
Well,
At the
Al,
club.
you were speaking about what if we start to see numbers really escalating? And it was I who brought up the single incident type of scenario. But so your question is really more about what if the regional numbers are, or the numbers right in town are soaring, then is it time to stop?
Mhm. And
Hmm,
what is that?
okay.
What is that threshold? Is it two cases? Is it 4 cases, 8 cases, 10 cases?
Wow, we've never seen 10 cases at a time.
No, but we've been very careful about activity in town.
Well, what if we get 5 cases, but it's determined that none of those cases came from the AC club? What if they were determined they came from someplace else? I don't see a need for us to shut down because the
Right.
case came from
Right.
someplace else.
It's sort of analogous to what I do with the elementary school. We have an agreement that if there ever are 5 cases in town, that we are going to at least meet and talk. And if none of those cases has any relationship with in-person learning at the elementary school, then they don't have to be concerned about it.
So we could have the same
immediately.
arrangement
So it could be.
about the club.
Mhm.
That would make, I like that.
Yeah, that makes sense.
Yeah, it does.
And we're talking about 5 cases over a 2-week period of time is what has been the agreement with
Okay.
the school. Just to ensure that we would at least be communicating, touching base. And I know if I were to know of that many cases and I had a point person, you, Mark, or someone else on the board that I could touch base with and say, so our numbers are going up, but in my investigations of the case, there's been no attendance at the AC.
Right.
Um,
But yeah, I mean, for right now, I think if you want to go ahead and contact me if that happens, and then
Okay.
we can discuss it at the board meeting.
Yeah. Okay. I think that said, it could be, there could be maybe a level of concern if we had 5 cases. Suddenly we have, you know, a tripling of the typical number of cases in town. And do you still feel comfortable continuing with your dinners, knowing that there could be an exposure, even if there hasn't been one?
Right.
Arlene, should we send you a list of the board members and ways of contacting them?
That would be helpful. You could send it to the Board of Health email, and I check that
Okay.
regularly. Thank you.
So when do you have it in mind to start?
Tomorrow. No, actually, we're thinking end of May to have our first dinner.
Mhm,
We have a lot of work to do prior to that, so.
sure.
But we do have music coming up earlier than that. May 7th and May 15th.
And how's that going to work? Is it going to be outdoors in the pavilion?
Yeah, they'll be on the stage under the pavilion. We'll have set up some seating under the pavilion distance, and then we got that 100-foot by 140-foot field where people can go if there's not enough room under the pavilion.
And is anything going to be served, or is it just going to be the music?
At this point, it was just music.
That seems good. So with the addition of a plan for meeting if cases start to increase in town. Are we satisfied with this document?
I think so. It seems pretty reasonable, and I think we talked through all the difficult points. So I would it would have my support.
Okay. Noreen, what do you think?
Yeah, I'm fine with that.
Garrett?
I'm also on board.
Okay. Arlene?
Yes.
Okay, me too. Claudia, do you see anything else that we need to deal with here?
No, I think everything sounds good.
Okay.
I am
Okay,
sorry
let's-
to hear about the lack of hot dogs, but you know, that's just me.
Okay, I think you guys are good. You have any
All right.
questions for us?
No, I think you've answered them all, and I just want to say thank you again for working with us on this.
Mhm.
No, it's a
Thank
pleasure.
you.
Okay, great.
Okay,
Thanks
Best of
very
luck.
much.
Thanks.
okay, I
good
think
luck.
we're done with that. Yeah. See you soon.
Okay, thank you.
Kat, I think Donna has signed in.
Super. Do we need Claudia's input on in
Excuse
talking
me.
with Donna?
The only thing is, I think Donna and the Lake Oil Association have some intent later on in the season to perhaps offer meals, so, but I don't think that's right away if Donna's there. I think that intent was in August. Is that when that meal was planned? Donna, I can't remember your schedule.
Yes, hello, I'm here.
Hi, Donna.
Hi, Donna.
Hi, everybody.
So
Hello.
that's so far out that things will be completely different, and there's
Yeah.
probably what I'm thinking is that we don't have to keep Claudia if she wants to leave.
No, I think that's true, but probably just like the AC, maybe a month in advance of serving food, or 6 weeks, because because I don't think Lake Wyola did anything last year, didn't have any experience with it. So, you know, they
Right.
might want to come back and talk to us and see, you know, what we recommend at that point. So
Right.
maybe mid-June, Donna, or early in July, something like that, depending on when you're planning to have your first meal.
Yes, we are just having one meal, August 21st. So, yeah, mid-July. I'll
Yep.
definitely touch base. And you're correct, last year, we did not even open up the association hall. We had nothing. So,
So that's good. Let's just put that on all of our agendas to talk again about that.
now, we are having one of those painting fundraisers mid-July. The teacher limits it, maybe 14 people, I think, in the hall. We always say masks are encouraged, or last year, even with the outdoor events, we just did masks and social distancing are always encouraged. Do you have any comments for this painting fundraiser?
I don't understand what a painting fundraiser is.
It's, well, they call it a paint and sip,
Oh, I see. I get it.
right? Yeah,
Okay.
the teacher,
Uh-huh.
yeah.
Okay. And you say you think you could do 14 people in the hall doing that?
I think that was their limit last year, so maybe
I
we'll
see.
say 16, just so it's covered.
What's
before.
the occupancy limit of the hall to begin with?
Ooh, it's a
in
lot,
non-COVID
like
times?
78, or
Yeah, the hall is big.
it's posted on the hall.
And so people could reliably be at least 6 feet apart? at
Oh,
all
yeah,
times?
yep.
Mhm.
Oh, yeah. Plus, you know, you could open up all those windows and you'd be really well ventilated.
Yes, oh, yes.
Better
I
yet would be
would
to do
love-
it outdoors.
Mhm. Well, we need light,
Oh, it's an evening thing?
yeah.
Hmm.
If we open up those windows, I really think we'd get a lot of air movement.
Yes.
Can request masks. Even, I bet even last year last year? No, we didn't. We had nothing last year, excuse me. The year before, the first year, I bet we were almost, I bet we were 6 feet apart because of all sort of the equipment, the bowls of water for your water paint and canvas and all this.
Right. Well, yeah, if it's an indoor thing, you'll presumably even then in August, or when is this going to be?
Early mid-July.
Okay, even then, I would assume an indoor thing, masks would be required by law.
Required, fine. Okay, you got it.
So it's hard to sip things when you have a mask.
Oh, that's a good point.
Yeah.
If this is being promoted as a painting and sipping thing, then
Maybe they'll,
there's a
can they
conflict there.
sneak a straw underneath to their Kool-Aid?
Maybe they could paint for a while and then like step outside and sip or something.
Okay, so, okay. You don't, masks required, period, no.
You know, if they're gonna, like on the airlines, they're telling people to, wear your mask, take it off, take a sip, put your mask back on.
Yes, we could follow that.
Yeah.
We could follow that for sure. Catherine, okay.
And Donna, the other thing we just suggested to the AC was, I know you're going to have an instructor and he or she are going to be busy telling people how to paint. So you might want to have a volunteer or two there to, make sure everybody's complying.
Okay. 1 or 2 volunteers. Okay, very good. And now, so the bathrooms, why I could buy one of those motion detector liquid soap dispensers at Lowe's and have a stack of paper towels. What else would you like for the bathrooms, if anything?
I don't know that a touch-free soap dispenser is really necessary.
It's not required. It's we're not so worried about surfaces as we are about airborne transmission.
Okay.
At frequent wiping down of commonly touched surfaces is not a bad idea, but you don't have to go the touch-free route. You can use a ordinary pump bottle of soap.
Okay.
If that's what you've got.
Okay.
And yeah, they should have a stack of paper towels and obviously, but
yeah, we always have the paper towels. If I can move on to our next event, we're very much hoping to have the August annual meeting outdoors under the tent, because last year we should have voted in a slate of the board. We're supposed to do this every 2 years. So we passed on it last year because the meetings were Zoom and it was too tricky for us to pull off voting. So we were hoping to have an in-person outdoor meeting on August 14th.
What's the usual attendance at these meetings, Donna?
35 or 40, you think, Noreen?
Yeah, that's about right, Donna.
Yeah.
Especially if it's outdoors, as long as you could have appropriate spacing, I don't see any reason why you can't do that.
Okay, so outdoors, do you want different households 6 feet apart?
Yeah.
Presumably, although
yes,
we don't know if that's going to be changed between now and August 14th.
but as things stand now, yes.
Right.
Yeah,
6 feet
I mean,
apart.
Yeah, that's the current standard we're planning for town meeting.
Yeah.
Right.
I like
And-
it.
And masks on.
Yep,
Mhm.
masks. I agree with all of the above. Okay.
And
Yeah.
what will you do if someone refuses to wear a mask to your meeting?
I don't know. Tell me what I should do. Explain to them that it's required, please, pretty please. And then if they won't, say,
You can seat them in an area that is well apart from everybody else.
okay, how much is well apart?
As far apart as you can get them.
I'll put them in the woods.
Right. In the poison
No,
ivy.
as-
Make sure you put them in the poison ivy.
As distant as you can, as distant as you can in a way that they can still hear the goings on of the meeting, but at least 6 feet, but ideally more. than
Ideally
6
more
feet.
than that, yeah.
More like
Yeah.
12 from the nearest person.
Okay, got it. Mhm. And then, yeah, then the dinner, August 21st. So I'm going to get in touch with you a month before that, and we'll see where we are with things.
Right.
Okay, contact. Got it. Okay, very good. Anything else you want to go over?
I think only the other agenda item, Donna, which was to just talk about potential for beach openings and how we want to work together should we have to close beaches this year. And I just want to say, I don't know if you got one, Kat, I don't know if you get mail from the association or not, but they put out a very nice brochure, educational brochure, Donna, that was really well done, I thought, and I hope people will attend to it, but it addressed the difficulties at the beaches and, what some potential causes are and what we have to try and do to, prevent animal waste from getting into the water, essentially.
No, now we got the folded in half newsletter. It's on Gary's desk. I haven't seen it yet. So it's part of that, I would assume.
It is.
Yeah,
And
yeah.
I thought it was nicely done. Did you get one, Kat?
I did.
Yeah.
I slid it open and put it on his desk first. I didn't see it, but so that's fine. I will find it. I will.
Well, I'm simply trying to compliment you, Donna. I don't know who did it, but I thought it was well done.
Oh. This is
You
an
might as well
LW.
take credit.
Oh, well, okay, fine. I like it. I like it.
So I think that's a good start. And I think the next things we need to talk about are, did I hear, maybe it was a rumor, did I hear that someone had written a policy for how we're going to go about closing beaches, or how the association is going to go about closing beaches this year, Donna? Or can you update us on that?
Yes, absolutely. After that fiasco at the West Beach last year, the board wrote up an official policy. The first part of it is sort of educational, but then the board of directors actions. So I have 6 bullets. Work with the Shutesbury Board of Health and Whitewater to resolve. That was just sort of a general catch-all to get things going. The second bullet, post no swimming signage with a red flag at the beach as soon as possible. This signage I'm getting printed now, and we're going to keep it at the association hall. There's a keypad outside, and the board members know the passcode. So if somebody's on vacation or whatever, any board member should be able to get in there and get the signs and get them on the beach as soon as possible. We were going to do a two-sided sign at the water's edge, more or less, and a sign up at the top. We weren't going to go into all of the detail that you are. We want a sort of general beach closed sign due to E. coli, no swimming, and something we can reuse year after year. The third bullet, we want to send an email blast to everyone on our list as soon as possible. Our fourth bullet, another sort of general, take necessary steps to resolve the problem. In other words, you know, keep your thinking cap on, keep things going, don't wait for somebody else to take care of it. We have to keep things going, keep in contact with the board and Whitewater. Keep the fifth bullet, keep members updated as needed. And the last bullet, when the Shutesbury Board of Health confirms the beach is safe to reopen, email the members and remove signage.
Sounds good.
Yeah.
I just have one concern and one question, and maybe because I know a little too much, Donna, and that is I know you don't have any board members who currently live at the lake. So
Yeah,
could
well,
that be a problem if we need to, you know, close a beach quickly?
Nick Yarmack lives at the lake.
Oh, true, that's true.
Um,
Can Nick be the designated person for you?
He can. Bill Crossman lives in Wendell State Forest, which is like a couple miles away, but he's not on the water. And during the summer, no, I take that back. I'm thinking
I
of
only bring this up, Donna, because I think I was the one who ended up posting a couple of times last year. So because I was around and, you know, I couldn't find anybody else on the board who was on your board, that is.
Yeah.
So that's why I raise it. So if Nick could do it, that'd be great. And maybe Crossman as a backup would be super.
Okay. And I think last year, you know, that was before we had this more structured policy. And I, as the president, I'd never run into this situation before. And so it was kind of a steep learning curve. Okay.
Yeah,
Nick?
yeah, no, I'm just trying to think of everything so we're ready this year.
Yeah, we have to. Worst case scenario.
That's really the only comment I have, unless someone else has a comment. I commend the board on, you know, developing a policy for this year. I think it's great.
Thank you.
Would we, as the Board of Health, also post those same beaches?
Yes. You post the sign with all the details, I think, right? Doesn't the state mandate, you know, all these details? That's what I remembered from our last.
We have to provide those, but I don't know that we have to post them particularly. We have to, it seems to me that what we did last year was say it was closed because of bacterial contamination and more information was available.
And I think
at our website.
I think we had to date it, Kat.
Yeah, that was the only thing. But you know, if we had some pre-made signs that we
Right.
could write the date on with marker and
Yeah.
then reuse them, that would work. So we should have a few of those made up on hand.
Yes. And Al, do you still have some stakes left? I think I had to run up to your house and get some stakes to do that last year that we had left over from the tick postings.
Yeah, I sure do. And I have
Sure.
some more tick signs too. So
Yeah, how many more tick signs do we have?
I don't know. I don't do weekly inventory of them. So I'll
You
have to-
don't?
I'm guessing it may be 5, something like
Okay,
that.
okay. We should do a little thinking about where's the best place to deploy them.
And I guess we could put the stakes in our new
In our
cabin at the
shed.
school. Yeah, new shed,
Right.
yeah. Although it'd be a lot easier for me to just have a couple here at the house if I have to go post or.
Yeah. So, Donna, do you have more things to say to us or to ask us, or do we have any questions we want to pose to Donna?
Do we need any signage at the beach? I think last year we did laminate some little signs that said, you know, please practice social distancing and masks, something like that. Should we,
Mhm.
would you like us to post at the beaches just for general?
That would be
I think-
smart.
Yeah, that would be great. I think we ended up doing that, Donna, but I think
Oh, I'm
I have
sorry.
one. No, that's okay. I'm happy to have you do it. I do have one that, you know, I think I went and pulled them off the beaches too. And, you know, so I have what that language was. If you want to post your own beaches, that would be great.
Yeah, we're happy to. So you want to send me the language? Is that it? No?
I can do that. Yeah, sure.
Perfect. Okay. So let me think. Meeting.
Let me just ask Arlene, I'm assuming it would be the same language as last year so far, that we'll just ask people to wear masks and social distance?
Yeah. And obviously, you know, a mask isn't going to be worn while someone is swimming, but while on the beach.
Right.
Yeah.
Could be, and I don't know how to word that succinctly, but
I'm pretty sure I have that language from last year. and
okay.
I can dig it out.
Yeah, please wear a mask on the beach.
Yeah, it was pretty
Yeah.
Be
simple.
simple. Yeah.
Yeah.
Okay. Well, if
Well,
there's
thank you,
nothing else.
Donna.
Oh, yeah, absolutely. Absolutely happy to work with you guys to keep everybody safe. Okay,
So,
Thank
Okay,
you.
signing out.
All right,
Okay, thank
okay.
you.
thanks,
Thanks,
Donna.
everybody. Thanks.
Good night, Donna.
Okay, are you guys all good with me?
I think we are. I was hoping you could escape at this point, or, you know,
yeah,
earlier.
sorry,
but
Claudia.
Okay, all right, that's all right. Okay, have a good night, everyone.
Thanks a lot,
Mhm.
Claudia.
Okay,
Thanks,
yeah, you're
Claudia.
welcome. All right, bye.
Is Grace here?
She is.
I am. Hello.
Hi,
Hi,
Grace.
Grace.
Hi. That
So-
was fun for me,
Oh, good.
honestly, listening
I'm
to the
glad you
side
enjoyed it.
talk. I
Okay.
did. I don't have favorites, but you guys are my favorites of all the committees and boards.
We are the coolest board. There's no question
It's
about
true. It's true.
that. So this is what we did last year at town meeting. We had a really big presence. I don't know if you noticed that. the day before, when it was being set up, Arlene got one of those chalk rollers, and she marked out the aisles and where the chairs were going to be set up for social distancing. And we, gave our advice about how things were to be set up. On the day of, Arlene and Al were up at the top of the driveway, interviewing people about their health and making sure they had masks. When they got down to the check-in for town meeting, they were being escorted to seating out under the tent. And then Garrett just about single-handedly kept the microphone sanitized and handed out those little shower caps that people were using for them. I think that's pretty much it. And we were sort of roaming around asking people to put on their masks or whatever. So those were our tasks last year. And I don't know how much of that, for example, interviewing people at the gate, that seems to me like maybe we don't need to do that this year. What do you guys think?
Agreed.
Agreed.
Okay.
I think we might want to have a sign with a large lettered sign that just says, do not come to meeting if you have this, or this, if you're experiencing these symptoms, or if you have been exposed recently to a person with COVID.
That sounds good.
Okay.
The only other thing that I mentioned last meeting was the issue that came up at the special town meeting when some members of the community wanted it to be a
secret ballot,
and that there was an issue around pens and cleaning the pens.
Yeah. So this time I'll have the pens outside instead of inside, but actually, no, wait, we came up with a better idea last year. So the ballots we use for town meeting are yes, no ballots. And yes is typed on one side and no is typed on the other. And people can just tear the ballots in half.
Oh, great. That's excellent. So they'll tear it and then they'll enter the one that they want to vote in the
Okay.
in the ballot box.
The reason we didn't do that in the past was we always print more ballots than we end up needing. And so we just reuse the colors, but I'm happy to just retire the colors.
Okay.
And cycle through them. Like that's just a ballot thing, a ballot design question.
So it'll be pen free.
Pen free, easiest solution. The part that I worry about the most is traffic control. I'm already noticing that people are forgetting their masks more and more when they come to town hall. And I think by summer, especially since we're going to be outside, a lot of people will, or maybe I shouldn't say I expect this, but I wouldn't be surprised if a bunch of people were like, oh, I don't need to wear a mask.
I have to say I've forgotten to put mine on twice today. I had it in my pocket and I forgot to put it on. So
yeah, a couple of times I've gotten out of my car and walked all the way like to the door of Big Y and realized that I had my mask on and run back.
I've driven all the way from home to town hall and been about to get out of the car and then realized I forgot the mask. Like it's totally gonna happen. And our experience has been that people are, for the most part, 99% of the time, totally chill about being asked to put on a mask, especially since we have plenty of masks that we can provide to people. But I definitely want the Board of Health there to help for that 1% of the time.
Grace, is an election happening that same day as well?
Yes.
So we have the same kind of dual tasks of a meeting happening and balloting.
Yes, though the election will be inside as usual, because we can open up the windows and open up the doors and we've got the new ventilation and I feel comfortable with that.
Okay. Well, that'll be better than having it out in the,
Yes,
in the corner.
especially in
Yeah.
terms of traffic control.
Uh-huh.
Right.
We have
Now-
experience with the presidential election now being indoors, and that
Right.
I thought worked well.
Yeah.
I thought so
Yeah.
too, yeah.
That one will.
And
When you s-
I don't even know if we need a Board of Health member at the election to monitor traffic the way we did during the presidential election, because turnout will be much lower.
Sure. Mm-hmm.
Right. When you say traffic control, are you talking about human traffic? You're not talking about vehicle traffic.
Right, human traffic. So people coming in and out, people lining up and bunching together, waiting to speak. And especially because we're outside, and I noticed this last year, because we were outside and the space wasn't confined, people sort of drifting off into the back of the yard and intermingling back there. Yeah, that's, in terms of my concerns, and because I'll be taking minutes at town meeting. And this was something I learned that, was different from being the assistant town clerk, from being the town clerk at that last special town meeting, is that taking the minutes at town meeting takes up 100% of my attention.
Of course.
Yeah, so
And so
I'm
it
not
should.
I'm not worried about touch surfaces, and I trust people to be responsible and respectful.
What about the microphone thing?
We have a surplus of microphone covers. And I do think that's a good idea, because microphones are like water fountains, in the sense that obviously you're not supposed to put your mouth on them, but lots of people do.
Yeah.
Yeah. Okay. So that will be a job for one of us.
Yeah. Yeah.
I'm the seasoned volunteer in that, I guess.
Go Garrett.
You'll be known as Mr. Microphone.
Well, you're right there if you want to say anything too, Garrett.
That's right. Your big chance. Since I won't be needed up top with screening questions for every person, I'd be happy to collaborate with you or take that on. I think you had Ken doing the other side of the room, so to speak. And so I can be that other side also.
Maybe you should ask Ken if he wants to do it again.
He might. I'm sure he had such a good time last time.
Well, we won't turn down any volunteers.
So the same size tent being sought, Grace? Are we looking for the same?
To the best of my knowledge, I'm not sure if anything's been finalized yet. I can check in with Becky tomorrow and get back to you guys.
And we urged all attendees to bring their own chair, right? Didn't we? And we had some available chairs for people who forgot or don't own chairs. But most people brought their own. And I think that's something to reiterate. And we had one porta potty, right? One?
I think there were two back
There
there.
two?
And some people were going inside.
Okay.
I don't remember, actually. It was either one or two.
Let's see if we can, hopefully we kept record of that, because who in the world would have ever thought that we'd need it 2 years in a row, but we are. So
there you go.
I believe it was one on each side of the tent.
Yeah, I think you're right.
Oh yeah, I think you're right.
You are
Yeah.
right. Yep.
Didn't we, Arlene, I have this memory of you going to grocery store and picking up a bunch of cases of water.
That was me.
That
was
That was
Pat,
me, and then
yeah.
I stacked them in the refrigerator. We used maybe 5 bottles of water and ended up giving them all to the fire station. So that just doesn't seem like a big priority to me.
Demand, yeah.
Although it was, as I remember, kind of a rainy day, or it was headed towards a rainy day or something.
Yeah,
like
it rained at the end of the day.
There might want to be some that the fire department has on hand in case they've got a person who gets affected by the heat or, you know, has a fainting episode or something, that they have something that they can offer to a distressed person, but
Well, we
Um,
can check with Walter and see if
Yeah.
they have water for those purposes. And
They
if
might
not, we
already
could
have that.
provide some. But last year, everybody said we had to have like 100 bottles of water or more. And I filled up a grocery cart with so much water that I couldn't push the cart uphill. You know how it slopes up to where the car park is? I couldn't get it up there. And it
Oh,
just,
geez.
it totally filled the refrigerator in town hall. I took a picture of it and almost none of it got used. So a little bit, yeah, a case or two at most.
So I still have the digital thermometers, the touchless.
Yeah.
We are not, it is, I don't think it is called for or effective screening really to check everyone's temperature, but before they go in.
Did you do that last year or did we not do it?
No,
No, I don't think we
not
did
do
it.
that.
Yeah, I think we decided.
used
did
this-
not do that.
Yeah.
Yeah,
We didn't do it.
right.
The select board, actually, I don't know if the select board did it, but that was something that in the second week of March, when Becky and Elaine and I and Kat, were you there? We're all on that meeting with the municipal association.
No, I wasn't there.
Oh. Yeah, I just remember Elaine being
Yeah.
really not supportive, and I
Yeah.
agreed with that. And we
So
talked
there are
about
still
how we
some
all have
places
completely
where-
different natural body temperatures.
Yeah.
Yeah.
There are still some places where it's being done, where you go
Mhm.
and people want to take your temperatures, but it's not common practice. And I think it's not the standard of care. or the
And
standard of
it's not
screening
useful.
anymore. Yeah.
So now that we have been doing social distance for more than a year, do you think we really need to mark the ground?
No, probably not. I mean, probably not.
I would think that if we just,
The only thing is the notion of leaving it to people's judgment as to where to set their chairs up. If we feel like we can at least go up to someone and say, can you please move your chair further apart from your neighbor here?
The benefit to what
You
we
know.
did last time is that if you leave it up to random chance, you know, some people are going to go and pick the smack dab middle
Yeah.
away, and
right,
others are going to go over here and over there. And the way that we did it was, I think, better organized, and
it filled in better, so there wasn't wasted
better.
space.
and
Yeah,
and you're not leaving it up to people to try to determine for
Mhm.
themselves.
And we ushered people to their seating area, didn't we?
right. We would take
Mhm.
them to a particular row and say, please go and
Mhm.
sit 6 feet from that guy in the red shirt.
Yeah.
So maybe it does make sense to mark the ground.
Okay.
Or to mark it in some other way. Maybe we could use stakes in the ground like every 10 feet or something, leaving a little.
People will trip over stakes in the ground, guaranteed.
I was thinking like tall ones,
Oh, okay.
if we have any.
Does anybody know what percentage of the town has been vaccinated?
No, but that actually gets into the one last agenda item that I had wanted to bring up that had to do with Marianne Antonellis's. It will take us in a little different direction. Are we done with town meeting here? I don't want to hijack the conversation.
Um,
The reason that I brought that up is that, you know, it's part of the lay of the land that is likely to be different than last spring, when we were just going into this and
Yeah.
didn't know what we were up against and everything else.
You're breaking up
Right.
a little, Al. It was hard to hear you. Now we can't hear you at all. You're muted now.
How about now?
Now I can
Yeah.
hear you.
now you're
Okay.
good.
So what I was saying is that this year is a lot different than it was last year. I mean, we were just going into the pandemic. We didn't know really what we were up against. Remember, we were really really into hand sanitizing and all that sort of thing. And now we also have more people in the community that are vaccinated. And I don't know if that number is approaching 50% or what, but
We don't know.
another dynamic.
Is there any way we can learn that?
Garrett, I don't know if you know of a way, but I've been giving some thought to this, but I don't know of one.
EPH does publish weekly community vaccination data.
They do.
The challenge with it is that it's subject to suppression rules, similar to case reporting. And so it's reported out by age groups. And so if there's not a sufficient number within an age group, the data is suppressed. So I haven't looked at the most recent one. It comes out every Thursday. So last Thursday would have been the last one, but to see if Shutesbury is out of the suppression area.
I just want to say that I'm going to be operating under the assumption that there are going to be members of the community who are just as vulnerable to COVID this town meeting as they were last town meeting.
Mhm.
And it's part of my job is to make sure that they are just as safe accessing and participating in town meeting as anybody else.
Absolutely.
That makes sense.
That access is really important. And we cannot base our protocols, our safety standards on the vaccinated group. We have to base it on the most vulnerable in the community. Yes, I agree with you.
Yeah, and that's how I'm operating as an election admin. And I'm so happy that I have you guys.
And
I'm so
really
grateful.
I'm really glad to hear you taking that approach.
Yeah.
Yeah, for sure.
Might we also get some pushback from people that say, look, I'm doubly vaccinated and so, you know, I'm not contagious and so I don't have to wear a mask?
Well, presumably the mask mandate will still be in effect and it's not our decision to make. If the governor says you have to wear the mask, you have to wear the mask.
Yeah.
And if you don't like it, complain to the governor because we can't help you.
There was an article in, I think it was in the Gazette that I was reading this evening about a group that is pressing Baker to lift the outdoor mask mandate, and he has refused so far.
Mhm.
But those pressures will grow on him.
Right, and everything could be different by June 12th. That's
Yeah.
still a couple months out.
Well, if that's the case, then I think we have to make the argument that Grace is making, that we have to plan and be respectful of those who are most vulnerable among us.
Right.
Yeah.
So as of last week, it looks like there were 738 adults who, let's see if this is, I think that this is at least one dose.
Mhm.
In Shutesbury?
In Shutesbury.
Well, that's pretty
That's-
good.
With at least one dose.
Mhm.
That's about half the adult population.
That's good. it makes me wonder if we want to have any kind of special accommodation for people who feel that they are at risk. If we want to have a separate tent or something,
Mhm.
something that would make people feel safer.
Yeah, well, we did last time have two small tents set up, I thought it was, one for people who could not or refuse to wear masks because you can't wrestle
Yeah,
people to the ground and make them do so, right?
right.
And another area for people who were
Not
vulnerable
voting.
or high risk.
Who weren't able to vote.
Well, there was that too. We had
Oh.
tents all over the damn place, and we had that.
Oh,
But we did have sort of unmasked people.
Yep.
Now we only had one unmasked person. That was Paula, and so she had a little tent all to herself. And the other tents tended to get used. They got co-opted eventually because they were just sitting there empty, and
Being
people
used,
were
yeah.
seeking shade under
Yeah.
them because it got hot in the middle of the day.
we also reserved the parking areas right behind town hall for
Right.
people who might feel so vulnerable that they wanted to stay in their car and
I
listen
don't
to
think
town
anybody
meeting from
did,
the car.
though.
And no one did, but it wouldn't be a bad practice to offer that again. As long as they
Especially
could hear it.
because some people will need to come down there and park anyway for accessibility.
So let's reserve that option for people. Let's see if we can do one of the pop-up tents for persons who say they cannot wear a mask and another one for persons who feel especially high risk or want to declare themselves that way.
Okay.
It's just how to identify them and direct them there is another question. If we're not doing the screening questions, how does one self-identify and go to the high-risk tent, or?
Wasn't there also a tent for individuals who are sensitive to scents?
I don't remember that.
I think that there was a separate, like, scent-free.
The whole town meeting is supposed to be scent-free.
But I felt
Be
like
scent-free.
a separate tent for that as well. But
I don't remember that we had a tent
That's
for
been,
that.
that has been
You're-
true in indoor meetings before. There's always been a fragrance-free section. Or,
It's true for all town events.
Yeah, you're right.
I mean, do people
right.
follow that rule? Are people aware of that rule? That's a different question, but
Right.
Right. Yeah. Okay.
Yeah, that's one of
Sorry.
the best things about these Zoom meetings. They're fragrance free. Remember that time somebody came really heavily perfumed to a meeting in town hall and she sat right in front of the fan? Ooh, that was terrible. So the only question for me that's still out is, do we need to put marks on the ground?
I don't mind doing it. The chalk thingy is here in our shed. And I actually ended up with extra lime last year, which probably is still kicking around town hall somewhere.
Oh, really?
Anyway,
Maybe in the shed. I thought we
I
were
don't-
asked to get all of our crap out of town hall and then eventually it went to the shed.
Oh, it's probably in the shed then either, but anyway, lime is cheap. And
Right.
I don't mind. It didn't take all that long, really.
Okay, that might be the best. Okay, Grace, is there anything else that you want from us?
no, I think that's good.
Cool.
Okay.
Thank
Great.
you all.
Well,
Before-
thank
You're very
you, Grace.
welcome. And of
Grace.
course, you're welcome to stay or go as we continue on.
I'm gonna take off, but you
Okay.
guys all have.
Okay,
Grace,
All
I
right,
have a question
bye-bye.
for you before you
Oh,
leave.
yeah.
Yep.
Yeah.
So I have signed in as the host for the Zoom meeting through the town's Zoom account.
Okay, cool.
When I started to record, I selected to record to the cloud.
Yes.
Does that mean that it's recording to the town's cloud or to my personal cloud?
The town cloud, the
Town-
cloud that's associated with the account, as in not your local computer.
Okay, great.
Yes. All right, good.
That's what I need.
excellent.
Thanks.
He's relieved.
And will that
Me too.
recording be sent to Garrett? as the host, or will it be sent to you?
That's not 100% how it works, but I have access to, I'm the one who has access to it and I manage the recordings. They're available upon request. If a bunch of people are requesting one Zoom recording, I'll put it on the website, either on somebody on a committee's page with that committee's permission, or creating a new page for it.
Okay.
But for now, we don't have a way of making all of the recordings automatically available on demand.
Right, but Garrett doesn't have to be
No,
responsible
Garrett
for
doesn't have
sending
to do
it, to you the way I
anything.
did when it was on Al's account.
Right, exactly.
Okay. Very good. Okay, thanks,
Okay.
Grace.
Thank you,
Any other
Grace.
Thank
questions
you.
before I
Doing a
go?
great job, Grace.
Yeah.
Thank you. All right. Good night, everybody.
Good
Good
night.
night.
So Arlene, you had some stuff about Marianne that you wanted to.
So I had a couple of things. First of all, and I'll keep them all really brief because I know we're running late. I have been meeting with the elementary school administration, and they had a return to full day programming early in April. And they gave the choice to families of continuing with remote learning or in person, and 95% of the families chose return in person for full day.
Wow.
They have updated their protocols, which are available on their website. They're lengthy, so I won't go into them here. But they do include lunch outside, no eating indoors.
Hmm.
Children bring 3 masks with them every day, and they are asked to change their masks 3 times a day. They have 40 students taking a bus to and from school. On the buses, 1 child is sat on each seat, although siblings can sit together. And at school, most teachers want to do as much as they can out of doors. Those teachers, many of them also have some of the at-home kids that they have to teach simultaneously with the in-classroom kids. And they are 8:30 to 3:10 p.m., 8:30 a.m., 3:10 p.m., except for Wednesdays where they are 8:30 to 1. So that is what's happening at the school.
Cool.
And the other thing was about onboarding with MIIS, which is the Massachusetts Immunization Information System. We had a phone call come through from a guy at MIIS saying that we were registered but not onboarded. And this is just a holdover from our prior status as vaccination providers. And when our provider account became deactivated, I guess we were no longer considered onboarded with MIIS. I didn't want to lose our registration status because of whatever role we might want to play in the next couple of years for provision of vaccines. So I'm going to go through the re-onboarding process. If we never need it,
good.
yep, if we never need it, we don't have to use it. But the only reason he called us was because they are getting around to cleaning up their registration lists, and we were one of the stragglers. Kind of, they were finally getting around to us to say, what's the deal? So there's that. Lastly, Marianne Antonellis talked with me one day when I was dropping something off at the library. And she said she wants to be a cheerleader for getting vaccinated. And so she threw out to me in an email afterward some ideas she's been having about what we could do to promote vaccination in town. And I'm a little uncomfortable here because she said we could have a big thermometer sign on the town common with the goal being 100%, and the level could rise as our numbers rose. And then I said to her, well, but how would we know about the numbers? And maybe when I'm onboarded on MIIS, I could see that, but maybe not. I don't know. But she said, well, people would have to self-report. Ugh, I don't know. There's something. And then she said we could have lawn signs that say, this family is vaccinated, and distribute those to people in town who want them. And then she said we could have t-shirts that to say I'm vaccinated with a
Kiss me, I'm vaccinated.
syringe and needle graphic on it. And then she said we could have car parades that go through town with drivers honking and say, I don't know, Marianne, well, I love you, but.
But come off it. Yeah.
So anyway, I promised her I would run this by the town. Anyway, I feel a little uncomfortable, and I don't exactly know why. Some of them are a little too they are a little too labor intensive for for what I have the ability to, participate with. But I guess she'd want to know, at least, does the Board of Health support such actions if someone else is going to do the legwork on it?
I just have a comment. I
Yeah.
think we should, we have some people around who are epidemiologists, and epidemiologists are really good at doing this kind of thing. And there's actually some really good data on what is effective in terms of reaching people.
Mhm.
Like sometimes just having your beautician or your barber or, your doctor remind you, or your good friend, talk about their positive experience. I mean, that's sort of the first level of success that people have with, encouraging people to get vaccinated. So there really are some ways that this can be done effectively.
To hear it from people whom you trust.
Exactly right.
And
Yeah.
I guess one of my levels of discomfort is creating an us and them dichotomy in
Right.
town. And we are a divided enough nation. I don't think we need to become a divided small town with
No.
people staking out their camps in this regard.
I agree with that completely, but I also agree that we're going to need some sort of, it'd be great to have some sort of campaign or way to encourage that next level of person who's a little bit reticent and needs some, help thinking it through or talking it through or something like that too.
Yeah, but what we
to
don't
make a
want to
positive
become
decision.
is competitive,
Yeah, no.
right?
Competitive with whom? Between whom?
Well, and there's,
Families or
make the, brag about your vaccination or have your thermometer up on the town common and that kind of thing.
Mm-hmm. Yeah. And although the numbers are small, there are some people who cannot be vaccinated.
Right.
And to have a very visible community level pro-vaccination thing may have a bad effect on their feelings about stuff, but about themselves. So.
Right. Although that, when we've been promoting the flu vaccine in the past,
yes,
that's always been one of our points, that some people can't be vaccinated. And
right.
That's why you should be vaccinated, to protect them.
Yes. Mm-hmm.
Right.
Yeah. All right. So I'm not alone in feeling a little queasy about the stuff Marianne was proposing.
Yeah, as far as the whole idea of sort of cheerleading, and it's a team and everybody needs to join it, that doesn't seem good, but encouraging people and informing people does seem good.
Yeah.
But I have done some reading about how the vaccine hesitant person is sometimes convinced when, well, kind of paraphrasing what Noreen said a few minutes ago, when members of their own community, people that they relate to and feel like they belong to, when they see that those people are going ahead and being vaccinated, then they feel encouraged. And so on some level, to see this stuff out on the town common or people's lawns might be part of that. But
well, I mean,
getting
that's a
together
lot
and
of what
talking about it very much,
Yeah.
I think that's more what they're referring to is actually having a conversation with someone like that, someone at your church, someone in your club, someone, a distant relative in your family, an encouraging conversation.
Yeah.
Right. Yeah. Instead of a t-shirt that says I'm vaccinated, maybe a t-shirt that says ask me about vaccination.
Yeah.
I am encouraged to hear the numbers that you're throwing out there, Garrett. Because for 750-ish adults in town and what we probably have about, I'm guessing 12 or 1400.
Yeah.
Adults in town
Grace
with-
said that's half the adult
Oh, yeah.
population.
Okay, right. She did say that. Yeah,
Right. And some
Nice.
people have only just become eligible.
I know.
Yeah, so it's in the data that they put out, what's strange about it is when you look at the total population, that's where they suppress the number.
Mhm.
And then, but if you look at age categories, so this seems to read to me that in town there are 85 people, 75 plus, 45 of those have had at least one dose, or at least, yeah, at least one dose.
Mhm.
Can you send us the link, Garrett, so we don't all have to search for that?
Yes, yep.
Thank you.
It's a very complicated spreadsheet because it's every single town and they break it
Mhm.
out by age, race, and sex and zip code, it looks like. Where you see the most suppression is when you start to get into the race category, but age, there seems to be less suppression of the data.
But you know what, that data could be helpful down the road if we do decide to do or encourage any sort of outreach to know if it's males or females or certain age groups that are more reluctant than others, or who
Yeah,
we
just
might.
seeing trends, in other words.
Yeah.
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 Yeah, so here, this is saying that 74% of 65 to 74-year-olds in town have received at least one dose.
Mhm.
So that's pretty good.
Yeah. Excellent.
So Wim didn't show up tonight.
All right. Well, he's out campaigning, maybe.
Right.
He may be
For his-
vaccinating
He's-
tomorrow. Is
he's on
anybody
the
working the
campaign trail.
clinic tomorrow?
I'm
I
working
am.
in, oh, where
am
are
too.
you?
GCC.
Oh, you're at GCC. I'm at
So
the
does
Zahn
Maureen.
Center.
Yeah, I'm at GCC.
Yeah, are you first shift or second? I saw your name, but I didn't pay attention.
I asked for a shift and they didn't give me a shift. So I had a
Gave you the whole
slash by
day?
my name, but nobody assigned to the slash.
Oh dear.
So I guess I show up at 1.
I'm going to be a traffic flagger. It seems like now this is my third time. Each time I get less skilled. The first time I was a scribe. The second time I was a greeter. Now I'm going to be a traffic flagger. I don't think I can get any lower. They're letting me find my own level, you know.
As long as they still let you eat a sandwich, you're good, Kat.
Oh, okay. That'll be next.
I'll be at the community center in Greenfield tomorrow for the afternoon. And then on Sunday, I'm spending the whole day at Hampshire College, vaccinating, I guess,
Wow.
students. I don't know, but my friend Sarah, who directs the health services there, she texted me yesterday and said, "Oh, I desperately need one more vaccinator on Sunday. Can you come?" So I'm doing it, but she's paying me. So
Oh, cool. You can't argue with that.
right.
You're great nonetheless, Arlene. All right. Well, Kat and I will have our sandwiches tomorrow. That'll be
Oh,
our
good.
Yeah. So Arlene, how's it working out with your job with Amherst? Your
it's been-
quarantine support.
It's been a trip, man, I'll tell you. Talking with lots of different people from many different walks of life and living situation and blended families and complicated tasks around quarantining. And and then there was an exposure at Fort River School with about 7 kids being exposed. And I had the unhappy task of calling their families on the first day of school vacation to say their kid had to quarantine.
Oh,
and then the very next day, the governor issued this declaration, or no, DESE issued these new guidelines that said that kids didn't need to quarantine unless they were within 3 feet of an infected person.
And did that apply retroactively or did they still have to quarantine?
I don't know. I have forwarded that information along to the school nurse and have said, do we even know whether it was 6 feet or 3 feet? Like, and she has not responded to me. I think she's probably in a heap on her living room floor right now because she also is dealing with this on the first day of her vacation. So yeah,
dear.
it's been kind of a mess there. But
Hmm.
so anyway, it has been something new and different every day, and
wow.
interesting stuff, manageable from my end.
Well, that's good to know, the manageable part.
Yeah.
Yes, we do now have 3 cases in Shutesbury and several
Oh.
of their contacts quarantining.
Oh,
And one of the cases was just hospitalized.
Oh,
So
ooh.
yeah, a bunch has
Yikes.
happened in Shutesbury over the last few days. So
should we have never included hospitalization in our weekly report. Should we do that or should we just give the cases and the quarantine?
I would not do it because I don't get word when they're discharged. So I don't
Okay.
know whether there's, and I would not have known this person was hospitalized except a new family member turned up positive. So I was in touch with the new positive and at that time was told that the prior positive was in the hospital. So it's unreliable information. Like, you know,
Okay.
it was just circumstances that led me to be informed about this one. So
Okay, well, we'll just stick to the way we're doing it.
yeah, I think so.
All right, someone must be hungry.
Yeah, I think we're all ready. Are we ready to adjourn?
I am.
Yeah, sounds good.
Okay. Yeah, it's almost 9 o'clock, geez.
Yeah.
Has anybody talked to Wim? I know he had problems, family problems. His mother was not well last time, and I haven't even caught up with him.
Not I.
I'll send him an email and tell him we missed him.
All right.
Okay.
Okay, are we done?
Yep, I'll
Yep.
see you tomorrow, Kat.
Yeah.
Oh, that's
Right, I'll
tomorrow
be
at
out there.
GCC. Ah, I'm Friday at
Oh, yeah.
the Zahn Center.
Yeah,
Okay.
yeah, I volunteered for Friday, but she doesn't roster him until the day before, so I don't
Yeah.
know.
Yeah. All right. Well,
Okay, you
enjoy. Have a
guys.
good clinic.
Yep, thank you.
Thank you.
Recording.
Bye.